Hi, I'm Dr. Martin Rukeyser and this is Dr. Lisa Rankin. I'm a chiropractor and Dr. Rankin is a medical doctor. We've both been in practice for 10 years independently, and now we are joining together to confront a problem which is affecting all of our children. In fact, Dr. Rankin has a son who has a diagnosis on the autistic spectrum.
As we know, autistic spectrum disorders are on the rise. About 10 years ago, we saw 1 in 10,000 children affected, and now we are seeing close to 1 in 100 affected. We're also seeing an increase in attention deficit disorders, dyslexia, learning disabilities, as well as other neurologic disorders. And anyone who works with children, whether as a physician or a teacher, can tell you we have an epidemic on our hands. Dr. Marty and I will be kind of dividing up the evaluation and the treatment for the children, and I will be handling the initial evaluation of the children if they have not yet been evaluated and given any particular diagnosis. I will be doing that as well as an initial medical exam. And I do want to stress that even though we may be diagnosing these children with a specific disorder, our goal is actually to help control the symptoms of that disorder. It's not as important that we have that diagnosis. We want to help improve the negative behavioral aspects, improve academic performance, improve concentration. So that's really our main focus, even though we have a diagnosis.
Right. You know, with autistic spectrum disorders and ADHD, often the diagnosis is not very specific. You know, these diagnoses are made from lists of behaviors that could be applied to one or many diagnoses. And so what we try and do is test the children specifically for neurological deficits and for nutritional deficits that can affect their nervous systems and their behavior in a much larger way than trying to pin it down to one particular diagnosis. One way that nutrition and our environment affects our health and our nervous system is by affecting the balance of the firing of our brains on one side of the body compared to the other side. The brain is divided into two halves, what we call the right and the left hemisphere. The left hemisphere is very detail-oriented. It's responsible for learning letters and specific vocabulary, while the right side of the brain is more of a big picture kind of thing. And it's responsible for understanding concepts. If the left brain recognizes a word, the right brain is responsible for understanding that word. The right brain also allows us to read people's emotions and understand our own emotions. And so in the last, say, 20 years, we have become much more sedentary as a population. We watch more television, we use computers, we play computer games. Any parent will tell you that when they were little, they went out and they played, and when it got dark, they'd hear their mom calling down the street and they'd run home for dinner. Today, a lot of our children are in the house a lot. They're watching television, they're playing these video games, and it is affecting the way their nervous systems develop. And one of the things that it does is it develops that detail orientation of the left side while neglecting that big picture aspect of the right side. And what we're seeing in children with autism and ADHD, dyslexia, and other problems is that balance is affecting the expression of the child's behavior. Typically, I'll be seeing the children in the office probably twice a week to stimulate whichever side of the brain we find, and whichever particular parts of the brain we find to be deficient in our neurological examination. So once we determine those specific areas, then we'll be designing a protocol of exercises and stimulation that specifically addresses those areas. So usually twice a week, the child will be coming into the office and going through usually about half an hour of stimulation, which includes vibration, light stimulation, sound stimulation. We do use chiropractic adjustments, which are very powerful stimulants to the spinal cord and directly into the central structures of the brain to affect that firing pattern and improve the function of their nervous system.
So the first thing we'll be doing is we'll be having the parents fill out a very, very detailed questionnaire about the child's health, their social history, any allergies they may have, immunizations, their diet, and then also a very detailed history for the parent, and also information regarding family dynamics, computer time, outside play, activities, things like that. And then we'll have the parent and the child come in together and we'll go over this, as well as in detail look at the diet of the child. And that's going to be an intervention that for most parents is going to be necessary. And then we'll also look at what other nutritional deficiencies might be present as well as any underlying genetic abnormalities that might be contributing to some of these symptoms. There are a small portion of these children who do have genetic abnormalities that you can see with testing that are causing the symptoms, but for the majority of patients that's not going to be the case. So we'll start off, like I said, with diet, and the majority of these children do have problems with gluten, wheat, and casein, which is a milk protein. So a lot of these parents are going to need to put their children on a restricted diet and pull these products out of their diet.
Which is not really an easy thing to do.
No, it's very difficult, and as a parent who's doing it, I can tell you it's a lot of work, and you have to involve the whole family. But what happens is, particularly with the gluten protein, which is the wheat protein, and the casein protein, when they are absorbed in an inappropriately large size through the small intestine, they cross the blood-brain barrier and they act basically like opioids. And so that produces a lot of that activity, the hyperactivity that you see in these children. It's almost like being addicted to a drug.
Opium, the way
Right.
you say opioid, so it's
Absolutely.
opium-based drugs like
Right.
heroin or morphine
Right.
or those types of things. Very, very serious
Right.
addictions. So it actually is very difficult for children and families to get off of these things, because very much like a heroin addiction, when you take the things away, you get a very strong reaction against that. And so it's really important for families to be united, and anybody involved with the care of the children really needs to take a look at this DVD and be on board with what we're trying to do.
Right, and most of you can probably look at your child's diet and realize that they love cheese, they love cheese sticks, they like macaroni and cheese, all the things that they should not be eating. And some of the other things that are often a problem in these children are issues with yeast overgrowth. And this may be related to multiple courses of antibiotics, or it can happen from as little as one course of antibiotics. You can also have a dysregulation of the immune system caused by an actual brain hemispheric imbalance. Or you can actually have a deficiency in some of the immune factors. And when you have the yeast overgrow, that causes inflammation in the gut. That leads to something called leaky gut, and that just perpetuates the problem with the gluten and the casein, because it allows those big protein molecules to be absorbed before they're broken down appropriately. So the yeast kind of goes hand in hand with the issue with the gluten and the casein. Then some other common things we see are problems with the B vitamins. They play very important roles in enzyme processes, and a lot of these children may have very subtle enzyme abnormalities in which it's not a true genetic problem that you can see with testing, but they may have what appears to be normal intake of these vitamins, but when you actually test them, they're low, or they may actually test in an appropriate level, but they're not actually being able to be utilized appropriately.
So there's a very strong connection between the gut
Right.
and the brain,
Absolutely.
the digestive system and the nervous system.
Absolutely. Some other issues we will see with these children are problems with oxalates. This is something that we all consume in our diet on a regular basis. It also can be a abnormal increase in this substance due to a yeast overgrowth, and these oxalates can be deposited in different parts of the body and cause discomfort in children. And one of the more well-known problems is if it deposits in the eyes, these children will have eye pain. And so some children demonstrate behavior where they're constantly rubbing their eyes or they're poking their eyes because they have pain there, and if they're nonverbal, they don't have the ability to express that to their parents. So there will be, for a lot of these children, supplements that we will need to have them take to overcome some of these problems. And some children over time may be able to reintroduce some of these foods, may be able to decrease some of their supplements, but there's a lot of them that this is a lifelong commitment. In order to improve their behavior, they're going to need to make these dietary changes.
Mm-hmm. Yeah, which brings us to another point, which is that this program that we're doing is not a quick fix type scenario. We're not seeking to, give the child one specific drug or nutrient that's going to instantly change their behavior. What we need to do is really affect their overall health and their nervous system over time. And so, our name, brain training, implies that this is something that takes some time. It's a process. Typically we are seeing children for 6 months to a year, although we do start to see changes in them earlier than that. The program is a longer type commitment.
Our goal is to create an individual program for each child. Everyone will be evaluated on their own merits, their own problems, and given their own kind of prescription. There's not one size fits all approach here for the children.
I think that's something that we've all found, and that is that there is not one thing that's going to cure all these children. And that what works for one child will not necessarily work as well or at all for another child. And so, in the beginning of our program, we do very detailed evaluation to tailor the program specifically for each child, so we're doing the best for them that we can.
Our goal is to take any of these children who are on drugs and eventually get them off of them. And I can, speak for my own son. After just several weeks of the dietary interventions, we were able to cut his medications in half, which I was, pretty impressed with, and I realized that to get him off of it is going to take a lot longer, but even to be able to decrease it in half and improve some of the appetite problems that you see with these meds was tremendous. So we're trying to avoid having to use medications.
A lot of parents, find personality changes that are somewhat unpalatable to them when they start these types of psychoactive drugs. Children become sort of zombie-like. They don't smile as much as they used to, things like that. Matter of fact, a little later we have a testimonial from one of our patients who's going to explain her experience, before and after, treating with us and doing some of the techniques that we do at brain training.
Right, and I think parents, like you already mentioned, need to realize that this is a lot of involvement for the child, for the parents. They're going to have homework that they're going to need to do as far as exercises. And we're going to ask that they check in with us via email on a regular basis to let us know how their exercises at home are going, how their dietary interventions are going, and then this will allow them access to us to ask any questions. So we'll be seeing them in the office regularly, as well as home assignments that will need to be done.
So let's take a look at a testimonial we have from a lady who had started bringing her child in a few months ago and see what she has to say.
My name is Andrea Puskás. My son is 7 years old. He's gonna 7 next month. And we find out he has ADHD when he was 5 years old. He started the kindergarten. Typical things, he wasn't able to sit during the class. He was disruptive. He was basically all over the place. His academic progression wasn't like he should do it. When we got the diagnosis, we started to give him a medication, stimulant medication. Right after when he started to use the medication, we see side effects. Typical zombiness, like he was like so spacey, he didn't smile, his personality was very different, and it was really, really hard to see him like that. So we started to look for other solution for him. That's how I find the chiropractor practice, Dr. Marty's office in Port St. Lucie. I was kind of skeptical because I never heard anybody around us who used chiropractor for ADHD, but that we thought maybe we can give it a try, and we started to work with him since 6 months ago. He's improved a lot in the classroom. He's sitting still. He's able to wait for his turn. He's lining up without wiggling. He's much better in the classroom. Right now, he is not on stimulant medication. He is doing fine academically. He's an honor roll student. We're still working with him with his behavioral issues. We have little help, so we have a behavior plan, and we try to keep that. But overall, we see tremendous progress since we started.
So he's made a lot of progress, but we still have some work to do.
Yes, a little bit.
Okay.
We are on our way.
Yeah. Good. Thank you very much.
You're welcome.